Whether it's COPD, heart failure, or another chronic disease, managing complex conditions can be a real challenge.
Yeah, it has led to the rise in home health monitoring. As Wink News health and medical reporter Amy Osher explains, keeping people medically supervised at home means keeping people out of the hospital.
Over the years, Eric Stemmers had a lot of heart problems. He survived 3 heart attacks and several heart procedures, spending a lot of time in hospitals.
I have congestive heart failure. I came down with that first, and I got a defibrillator and a pacemaker put in.
His problems aren't going anywhere, and Eric would like to do the same. He wants to stay home if it's medically safe.
They mailed me a blood pressure cup, a scale, and the blood oxygen, and it automatically monitors on my laptop.
He's part of a growing patient population monitored by home health.
It's really kind of the future of medicine, where we meet patients in their home at their place of service, really at their convenience. So what this program is built on is people have chronic conditions. They often have very small changes, and these small changes over time can accumulate and cause an exacerbation of that condition.
One that can be life-threatening. But by using take-home devices, patients can monitor metrics like blood pressure, blood oxygen, and weight. Data goes into a computer and is checked by a nurse or doctor in a central command center.
And it's really been an evolution, one from a clinical perspective, adding physicians around the program or adding nursing and specific care team, specific diagnosis and symptoms for the patient, but also then the technology.
As home health grows, it reaches more people. Beginning with chronic conditions, it's expanded to acute conditions like high-risk pregnancies and septic infections, things that require close monitoring. Being watched virtually is most patients' preference.
The patient doesn't want to go to the hospital unless they need to. The patient doesn't want to be at the doctor's office unless they need to. So it's finding that correct level of care.
Eric's heart is working at 25%. So remote monitoring is a lifeline for him.
I can even go anywhere and not have to worry about it because it's got a tracking monitor in it.
Easing worries knowing his heart is in good hands. Amy Osher, Wink News.
And hospitals are monitored too. Lee's 30-day readmission rate is 50% lower for people on the home watch, keeping the system and the patient in good health.